One of the misconceptions out there is that children living with autism have intellectual disability, which is not the case. Yeah, so it's case by case basis, whereby you need to evaluate each child and assist that child.
But you go there and the teachers are like, there's something more. He cries all day. He's holding his ears. He's not eating with the others. And by 2 years, we were still doing blended food.
The funny thing that we see, you might project yourself onto an autism person as normal, whereas most of the people living with autism, after being asked, they feel like we are the ones who are not normal to them.
Ask myself, is it something that I did when I was pregnant? Is it that I didn't take the prescribed supplements? Is it I didn't rest enough?
Welcome to the Med Squad podcast. Now, you know there are times you look back on your life in high school or primary school, and with the knowledge you have now, you regret some of the actions that you did towards certain classmates or schoolmates because you didn't know then. And now that you do better. That subject is what we're addressing today. It's the topic of autism. Should it be called autism? Is it still called autism? It's the Med Squad, and I have with me the Med Squad, and I'd like them to introduce themselves. We'll start from my left.
Dennis Mandere, therapist at Zuri Health.
Hi, everyone. I'm Christine Njagi. I am a pediatrician.
All right, karibu.
Hi, everyone. My name is Pauline Elizabeth, and I'm a caregiver for a child living with autism. Thank you.
So now as you've said it, a child living with autism. So what terms do we use? I know there are times when trying to be sensitive, someone might be offended if you say autism, and they say, no, say spectrum. What do these terms mean? So, or how would we define, autism?
Okay. So thank you for having me. As you correctly said, autism is a spectrum, meaning there are many things that we look at for us to identify a child as having autism. So to begin with, it's a clinical or a medical condition whereby a child will present with communication challenges. They'll also present with poor social interactions, and they'll also have repetitive behaviors. Yeah, so in a nutshell, that's what autism is.
So when you say repetitive behaviors, are there specific ones or is it just general?
Okay, yeah. So when I say repetitive behaviors, we have either they move their hands, so flapping of hands, or sometimes they repeat words. They pick a certain word where they say, we refer to it as echolalia. That's a medical word for repeating words. So they identify one word and they keep on saying it. So sometimes you find they're maybe in the middle of saying or communicating, and then they keep on saying the same word, the same word. So that's what we mean by repetitive behavior. So either movements or just words.
Okay.
Yes.
So when you talk about repetitive words, I'm thinking someone might think this child has a stutter or stammering.
Yeah.
So what are the common misconceptions that you find in encounters with these children?
So one of the things that we encounter with children living with autism is one, they can be mislabeled as having intellectual disabilities. Yeah. And one of the things that, as we said when we began, that autism is a spectrum, meaning you can find a child who is able to learn, who is good in maths, is good in so many other activities. And also you can also find another child who requires some assistance in even performing some daily functional skills. Yeah. So one of the misconceptions out there is that children living with autism have intellectual disability, which is not the case. Yeah. So it's case by case basis, whereby you need to evaluate each child and assist that child depending on their needs. Yes.
So and to add to that, JFSC, in terms of presentation, each child presents quite differently from the other one. In terms of the symptoms that they'll portray when you're doing a diagnosis of such a case.
Yeah.
And in terms of talking about it as a spectrum, so under autism spectrum disorder, you'll find autism. You'll find something that's a bit outdated, we call Asperger's syndrome, where it presents kind of like autism, but it's not autism. And what have you.
Yeah.
When she mentioned intellectual disorder, in difficulty or disorder in terms of autism, this is where a child with autism might not necessarily have intellectual disorders, but they might be living with. So you can't cluster autism as an intellectual disorder.
Okay.
You might find someone who is quite functioning in society and quite functioning in terms of educational capacity, but also having autism. Doesn't mean that they have an intellectual disorder or disability.
So, Pauline, for you,
Yes.
you have a more personal encounter with this. And we've had the clinical side or the professional side, but what does it look like? What does the spectrum or autism look like before diagnosis?
Before diagnosis, there's a lot of confusion around it, because by the time you're carrying your child to term, there are certain expectations, especially when it comes to milestones. No. So you find that by the time your child is 2, there's no speech. They like arranging things in like if they're playing with toys, or if they find shoes, you come home and you've just thrown your shoes there. You find your child is not communicating verbally, but they've taken your shoes and they've arranged them in a certain order. You find that they're quite independent from a young age, and you think that is okay. But if you compare with the children in the same age, you find there's a lot of difference. So there's a lot of confusion before diagnosis. And I look at it as the autism brain, like it's in a pod. No, it's in a pod and it's in darkness and it's not been exposed, because once you get diagnosis and you get a lot of help from the doctor, from the therapist, then you start exposing the brain to different environments, to therapies. Then you see the child changing or improving and hitting those milestones. So that's how you look at it from before and after.
And did you discover this pre-school going age or during school? And how was the school experience, if there was?
Let me tell you, mine was quite strange. You know, our African mothers. So I was working, my husband was working, but we have an older child. And I didn't notice much. So my mom came home and she visited and she was like, there's something wrong with the child. I don't like the tone he's crying with, and he's not talking. And I'm like, oh, I didn't notice he wasn't talking. So that was like 2 months shy of 2 years. And her solution, take the child to school. Quickly took the child to school, half day. But you go there and the teachers are like, there's something more. He cries all day. He's holding his ears. He's not eating with the others. And by 2 years, we were still doing blended food. So I knew there was a problem. But you know, as a parent also, you don't want to really accept that there's really a problem. And you want to buy time. Like my mom would say, just take this child to school and within a year, he'll be fine. Don't worry about it. But it came from the teachers now. Because he wasn't sitting in class, he wasn't feeding. And there are others who will tell you there's a problem. There are the other institutions that will tell you he's fine, he'll pick up. So one day I went to pick him up from school and I found him sleeping in the playground. And that was the most painful thing. He was dirty and he had cried himself to sleep on the playground. And I stormed in the office and shouting and like, is this what happens to my child every day? And they told me bluntly that we feel like your child is in the autism spectrum and you need to go and get help. Then I was like, why didn't you tell me before? He's been here for almost a year and you guys are not telling me anything. What should I do? So I stayed home for around 10 days, just trying to like, what do you mean autism? What is autism? And I'm a research-oriented person, so I went and Googled. I was like, no, it's not possible. Why? Because I can see some autistic, if you check videos then, Kids were banging their heads.
Yeah.
Kids were drooling others, and my son was nothing like that. He was a very quiet, gentle boy. So anyway, we went and got the diagnosis, and we were told it's autism.
Yeah.
And definitely we didn't take it well, especially when you're told it's a lifelong disorder. You're like, lifelong? So at first I was thinking death. No, I was thinking, okay, I didn't really know what to think or what to even, because if you tell me lifelong, I'm thinking of cancer.
Yeah.
No, I'm thinking of death. For me, that is what really scared me, because I thought autism, lifelong, this is death.
Yeah.
What am I going to do? Yeah.
At any point, did you feel like there was anyone along up to the point where you got the diagnosis?
Yeah.
That anyone empathized with you, or did you feel kind of alone?
So I started thinking that I was the problem.
Yeah.
Because this is my child. My firstborn is fine. So I asked myself, is it something that I did when I was pregnant? Is it that I didn't take the prescribed supplements? Is it I didn't rest enough? I looked around my family, there was nothing like that. And my husband's family, there was nothing like that. So this was a me. I felt like it was a me problem. And honestly, I went into depression.
Yeah.
I had to see a therapist just to realize that this was not my journey. This was my son's journey. And the only way that I was able to help this boy is if I removed myself from the equation and stood on the sidelines and start asking myself, okay, so what is Daniel's journey?
Yeah.
How can I help him and support him to be independent in future? Because what we are looking at now is independence, and to what level? It really hit me hard that he was going to be my lifelong companion.
Yeah.
No? And so you start getting worried, like, okay, what if I'm not here? What will happen to him? Is there anyone who can take care of him the way I would? No. So if he's going to be my lifelong companion, what kind of a companion do I want? Can he read? Can he eat normal food? Can he be able to sit in a restaurant? Will he ever be independent? There's so many questions that you ask yourself when you get that diagnosis and you really understand what autism is. But I was not ready for what therapy, could do. And it really changed the whole face of autism in my mind and even in my family.
Yeah.
And I thought I was the only one. And when I started talking about it, I realized that actually in our family, there is someone who had a child, but no one was talking about it. Yeah.
Wow. First of all, thank you. Thank you for
Isn't
sharing.
it funny that especially the way you've articulated it?
Yes.
It's like something every mother in Africa who has a child living with disability has gone through the same conversation.
Yeah.
Do you have numbers or statistics on the prevalence of autism?
Yeah, at the moment, I think 1 in 25 kids born in Kenya has autism or is presenting along the spectrum of autism spectrum disorder.
Yeah.
Globally, it's 1 in every 100 births.
Okay.
Yeah.
Wow. So what we're going to do, because thank you, really, thank you for being open with us. We're going to take a break right here on the Med Squad podcast as we talk about autism. And when we come back, we'll dive a bit deeper and find out some of the terminology and what it actually means so you can distinguish between it. Stick around. Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Peer care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuru Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. Welcome back to the Med Squad podcast. We're talking about a subject that is, well, surrounded by sometimes confusion, sometimes myths, but more importantly, untold stories. We're talking about autism, and especially in the context of Africa. Now, I want to find out, where does the term, is it neurodiversity or neurodivergence?
Divergence.
Where does it come in? Neurodiversity, neurodivergence. Does it come into this?
Okay.
Nice.
Yeah, so actually you'll find a lot of people talking about neurodiversity when they talk about autism. One is because autism is a neurodevelopmental, yeah? So neuro meaning brain, developmental, so meaning how this child is developing, yeah? So it basically how the brain responds, yeah? And this helps this child to react to different situations. Like mom was trying to tell us about her son, that sometimes they even have excessive response to stimuli. Yeah, we find children closing their ears because maybe the noise is too much. Yeah, which maybe the other children are not able to perceive it that way. So it's basically how their brain processes things, which leads them now to react the way they do. So based on the communication, or now having the repetitive behaviors, or just being isolated, or they just don't want social interactions at all. Yes.
Okay. So now you talked about going to therapy, and so you have the diagnosis.
Yes.
Now it's time to again go back to the subject of school.
Yes.
So what did you do? Because of course there's now what do you do? Does Daniel fit in with the other classmates, or do you have to move schools, or what did you do?
I homeschooled. I homeschooled because first I wanted to understand what I'm dealing with. No. And remember, we already came from a school setup, and they said the child has a problem, and we got the diagnosis. So we dived right into therapy. And I felt like it was not enough. And by then, when we got the diagnosis, he was 2, and there was not so much information to go around with. Even the pediatricians, the neurologists, they would just push you to do the recommended tests, but they don't tell you, okay, so after this, where do you go? So you find that caregivers have to curate their own solutions. So I looked at what I wanted Daniel to achieve. And I decided to form a home-based program. So I was lucky to have a few therapists that would guide me, that have been seeing children for many years. And they were like, Pauline, this is where you need to go. These are the resources in Kenya. These are the resources out of the country. And we opted to go out of the country after 1 year of homeschooling. And I can tell you, it is not cheap.
It's not cheap.
It is not cheap. It puts a strain on the family, it puts a strain on your finances. Remember, you have other children. And it takes a lot of sacrifice to just get your child from one level to the next. You have to be patient, because we are the ones, the neurotypicals, we're the ones who feel like the children have an issue. Remember, autism is not a disease. It's just a developmental disorder. So you can't say that in 1 month the child will have speech. In 2 months the child will be writing. No. So they take their time. So it took us, my son got speech at 7 years, and we started therapy at 2 years. It got to a point I felt like, I'm so done with this. Let me just leave him and let him be what he wants to be. But again, when you go back to therapy, you're told, no, consistency. The brain is a muscle. This doctors tell us, the brain is a muscle. Just keep exercising. Oh, speech is like a coloring on the wall. Be patient. And I can tell you at 7 years, I had first words. And they were like a sentence, "Mommy, I miss you." I was like, what? And I was leaving him and I really broke down. It was the best thing. And then he went quiet again for like 1 week. So you see, therapy, you have to just, every child with autism is different. There's no two cases that are the same. What fits you might not fit my family. Yeah. So you have to sit down, you have to really be patient as the parent and support the child where they are, not how you want them to be.
Yeah. So you've heard what Pauline is saying.
Yeah.
So there's not everyone would make, even if they make the sacrifice, it's still difficult.
Sure.
And it's expensive.
Yeah.
Is there pressure? There is. I know there is pressure for the child now to be normal. Like once they achieve certain milestones, be like the rest of them. So now from here, just move the way. And then what kind of strain does that were put on the people who may approach you that you've encountered?
Yeah, so one of the things that actually we encourage caregivers or parents of children living with autism is, one, do not strive to make this child normal. Yeah, just the approach of therapy and supportive care to this child is to help them to be as functional. Mm-hmm. The word is functional, yeah, not normal, because already this child has been born with this developmental disorder. So we are not striving to make them normal. Mm-hmm. We are striving to make them functional, to be able to interact with their peers, to be able to communicate, to be able to actually even play with other children. Yeah. So it's all about functional. So there could be a lot. And maybe one more thing that I can add, you find, again, children with living with autism, they also have other coexisting disorders. Yeah, they could have anxiety, they could have depression, they could have what we call OCD, yeah? The obsessive compulsive disorder. Yeah? So you may find, so the more pressure you put on this child, actually you may actually push this child away, yeah? Because they'll become anxious. They'll not be looking forward to the therapy session because the pressure is too much. So I like Pauline's approach that you have to be very patient. And again, even if they are siblings, they'll have different journeys. Yeah, you'll find this child was able to talk at 7 years. Another one will be able to talk sooner. Another one later. So every child has their journey. And I believe one of the things as health workers, which maybe we did not tell Pauline, is that every child has their journey. And we should be patient. We should support parents. We should support caregivers to be able to walk this journey with their children.
So if you see another thing that ties into the normal narrative, that's what pushed someone to coin the term neurodivergent. Because what's normal?
Yeah.
The funny thing that we see, you might project yourself onto an autism person as normal, whereas most of the people living with autism, after being asked, they feel like we are the ones who are not normal to them. So what's normal? Is that relative to you? Does it make sense?
Yeah.
No, it doesn't. Because they formed that term, the neurodivergence, so that it doesn't portray us as having the normal kind of behavior. It's just that they're different.
So is this
it's not abnormal per se?
So then is it a medical issue or a social issue?
Both. It's a neurodevelopmental issue. It's a social issue on our end because we are not supposed to force them to be like us. They are supposed to integrate them into society as who they are.
Okay.
Yeah.
So now for Pauline, back to you.
Yeah.
Did you feel any, because the journey on its own was difficult, even within just the nuclear family.
Yes.
Did you feel any social pressure or isolation from the extended family? Or at any point, did you feel like, even while you felt like giving up, were there factors including support?
Yeah. I think we're still isolated. It's a bit better now because there's more information, but I can assure you were isolated for many years. Because first, the nuclear family is assuming that you're spoiling the child. You're not, for example, if you go for birthdays and he's climbing on people's windows and you find that, those, when you're growing up, there were those wall units, you find you're looking for him and he's on top. You wonder, how did he get there? So you are expected, in the African setup, you're expected to bring him down and chopper him. And that's not going to happen because I know what is going on. So the invitations stopped coming. Birthdays stopped coming. I can assure you that all his birthdays, we've either gone to children's homes or we've just done a small setup because no one invites, no one comes for his birthdays. So there was that isolation and you can't even go to church because the noise is too much. Before we understood that it was a sensory thing and we could get the earmuffs and not everyone can afford earmuffs, you see. But I'm glad that there are some churches that have special units, even for Sunday school. Now we can comfortably go to church and he's playing or he's coloring and doing what, and you can enjoy a service. But before, I can assure you, we were totally isolated.
Did you ever feel the urge to insist on, inclusion at all costs? Like, you people are the ones with the problem. You should, you people are just.
There's something called personal space.
Yeah.
I cannot force you. I cannot force you to invite my child. And if you don't invite my child, I will not come to your functions. So I did not force anyone. What I did is I started talking about my son's journey. I started sharing on social media, like we would go somewhere and they would see that my son is a great, better than their children. So they're like, okay. Does he compete in school? So you get him in competitions. Where you find spaces where kids are playing musical instruments. You teach him, and they are very intelligent. If your child takes maybe 2 weeks to learn, my son needs only 2 sessions.
Yeah.
So he started excelling in different activities, and people started warming up. And they're like, okay, fine, he's a bit different, but he can be taught. He's not violent, he's all that. But you see, that is just my son. What about other parents? What is happening to them, other caregivers? I can assure you, that's why we formed small communities. We have support groups everywhere that you go. So, and we've started meeting up, even parents, just to talk about this, so that you can understand that this journey is not yours only, and that you're not alone in this, because it is a very isolated journey. Whether you're aware or you're not aware, I can assure you that disability is a topic that even our governments are not ready to face. Yeah.
Wow. So how for on the professional side or the clinical side, how do you manage the condition?
Okay. So once we've suspected, because it starts maybe from a concern from a parent, from a caregiver or teachers, because sometimes we find also the feedback is coming from school.
Yeah.
So we'll take a good history, starting all the way from prenatally. And remember, there are also other conditions that can exist in these children, or could actually be something else, not just autism. So we really have to take a good clinical history to be able to arrive at a diagnosis. So starting from way before this child was born, during pregnancy, were there any risk factors? During the infancy period, how are the other milestones? Because we also want to know how are the motor milestones, so basically walking, talking, at what point did this child sit? So we really want also to follow that developmental milestones. So once we've actually examined the child and suspected that they could be having autism, so there's some tools that we can issue to these children. Either can be issued by a parent, so you can actually guide them on how to do it. Or actually, I can do it as a health provider to see whether the child is meeting the diagnostic criteria, because there's a diagnostic criteria that has been published for diagnosis of autism. Then now from there, we can be able to guide them on how to to enroll to care, either now speech therapy for the children who've not achieved speech. We can enroll them for occupational therapy for those ones who are not able to perform functional skills, and also physical therapy, because as we said, we have children from requiring minimal support to those that require extreme support. So there are those that also will require physical therapy. Yeah.
Okay. Is there any medication involved, or is that not part of management?
It is, but in extreme cases. But mostly because autism is a behavioral type of issue, we mostly engage in the CBT, the cognitive behavioral therapies first before we engage in anything to do with medication. By CBT, I think Pauline will tell us, because she's more at, for every child, the first thing you have to gauge is how they react to the stimuli around them. Is overstimulation beneficial to them? Is understimulation beneficial to them? Then you react to that. That's what guides how you treat this kid.
Yeah.
For instance, you heard her say her kid wanted blended food till 2 years of age. Does that come as typical behavior to you?
Like, unless I'm an expert.
No, judging like from the kids you have. Is that like a typical?
Well, no, but
It's kind of tricky, yeah?
Yeah.
So in such a case, what do you think happens? Why would a kid prefer blended food as compared to food he will readily chew upon?
Yeah, I don't know. In
swallowing disorders, chewing and swallowing disorders.
So there's that. They might be a bit sensitive to the texture of food, so they like it a bit more blended. So in such a case, you kind of go the blended route, then integrate small bits of food until they come to a place where they can chew the food. So for instance, some autistic kids don't like to be touched. In such a case, you'll find there's a certain texture of clothing, if you put on them, they won't react violently. Okay? So you have to be, even when you're doing the diagnosis, you have to stay with the kid for almost an hour to see the behaviors. You see how they react to the environment, how they react when you try to communicate with them. And by communicating with them, I don't mean the way we typically feel like the way you're communicating now through speech. For a kid, it's much more than speech. You being there, your body presence, how warmth you feel to them, because they, as much as they're not physically maintaining eye contact with you, they are noticing everything that's going on with you. Trust you me.
Yeah.
So as I was saying, in terms of treatment, each kid is kind of different. So every modality will be measured in terms of how they present. If they are overstimulated, the treatment will involve bringing down the amount of stimulation in the environment. So it might be touch, it might be sound, it might be light. So if maybe the room is kind of way too colorful, we put them in a less colorful place with dull colors, or maybe even use a dark room in such a case to lower the level of stimulation that's being presented to the brain.
Yeah.
If they are understimulated and they keep on jumping up and down, it means they want that engagement, that stimulation. So you engage things like jumping, throwing the ball, just physical activities that are really intense to the body so that they get that kind of stimulation that they want.
Yeah.
You can judge by their behaviors. For instance, if a child does this, what does that entail?
They don't like the noises. With something.
So you lower the noise volume in that particular environment, such and such.
Okay.
Yeah.
Now, when we come back, we'll be looking at actual identification and diagnosing of autism and what it actually means right here on the Med Squad podcast. Welcome back to the Med Squad podcast. My name is Yafesi, and I have the privilege of sitting here with Christine, Pauline, and with Dennis. And we're having a conversation about autism. Now, one of the questions I want to ask when it comes to identifying and diagnosing, is diagnosis a must, or should we first have support in place?
That's a very good question. And I would say we need to diagnose first. We need to diagnose because one, we could have other coexisting disorders. One, I would actually want maybe to emphasize on hearing impairment. You'll find a child with hearing impairment who's been labeled as being autistic. So it's very important for us as a medical team to do a good clinical evaluation and actually arrive at a diagnosis so that we can be able to support this child.
Yeah.
Yes.
Okay. So then the thing is, do most health workers or do a good enough number of health workers recognize autism?
Basically, you haven't learned about the correlation between the two. Because with hearing impairment, what comes next? Speech delay.
Balance, maybe?
Yeah, speech delay or impairment. So, especially because most people have the notion autistic people don't talk. You know, you usually say they don't talk, but for me personally, I feel like they choose not to talk. For instance, if they want to talk, if they want to say something, they will say it, then they'll go mute if they want to. So when a child has hearing impairment, the speech will be delayed. So 4 years in life, then you'll feel like this child is not talking. So probably they have autism. So that's why it's really important for someone to go for a diagnosis and a screening at a health facility.
Okay.
And just to add to that, I think it's very important to get a diagnosis first so that it directs you on the journey to take.
Yeah.
Because if you start, if you from your own mind, like Dr. said, you might find that there's ADHD, there's autism, there's cerebral palsy in one child. So you really need to know exactly what you're dealing with first, then know the steps to follow before you start any intervention. Because if you don't know, you might be targeting autism interventions only, and maybe it's a hearing impairment, maybe there's fluid in the ear, there's growth, things that we have seen.
Now, you've been on this journey for a number of years.
Yeah.
Did you have to make modifications, or what kind of modifications do you have to make to your lifestyle in general? And did you have to make modifications to the home, to the house for like stimulus and things like that?
I think my whole life changed from diet to sleep routines. I think autism gave us more discipline in the house because when we started understanding what the boy needed, the house, that means that everyone had to adjust. And sometimes it's not fair or easy for the other children in the home. But for example, we have one junk day. So we don't have junk at home. Why? Because sugar and wheat and all that, it gets him hyper. So what do? So we have Friday as junk day. Then we make sure that he's very engaged on Saturday and Sunday so that by Monday, we are back to a normal routine. We need a sleep routine because he used to have a difficulty when he was sleeping because he would sleep and wake up at odd hours. So we had to sit down and in behavior analysis, there's a form that is you're given when you're doing when they're still doing the assessment on the child. It's called an ABC form. So you are able to really understand your child that, he sleeps for 6 hours. So if you want to sleep in on a Saturday morning, that means that you have to make sure he sleeps late, and if he's tired, he'll sleep. If he's not tired. So we would do walks and we would have those late bath times. And for example, the diet, there are certain foods that were not good for him. So it is easy, instead of making maybe 3 different meals in the home, it is easier and healthier if the whole family can adjust to that diet. Yes. So we also, the environment that you're living in, you have to make sure that the environment is not too noisy, because for him, he gets very agitated when there's too much surrounding noise. So I always feel like, I'm not sure because I'm not autistic, that maybe if there's one beat for him, there are 10 beats in his mind. So if music doesn't bother me to a certain level, so I feel like if he hears it like 10 times more, it's like it's multiplied. His senses are multiplied, to say maybe they have yes. So we had to move to a quiet home. We had to diet, sleep routine, everything. Even the way people like getting woolen sweaters, he can't do that.
To this
yes. So I didn't even know that we had cotton sweaters for the kids, So we had to really change a lot.
Wow.
Yes.
Hey, Even the question I was going to ask is: are you still on the homeschooling journey?
No, I'm very happy that we are in a mainstream school right now, and he is performing exceptionally. And but we homeschooled until grade 4, so he's been in school for only 1 year.
Yeah, I
can assure you that it works.
So how old is he now?
He's 11.
Wow.
Yes, he's 11.
So I'm caught between trying to find the information and also just admiration for what Pauline has done.
Yeah.
But now, what frustrations do clinical workers face with regard to, with children with autism, or even as you speak about that, even going into adult life? What frustrations do you face, whether it's from society or from the family or at whatever levels?
So maybe one of the things, or I would say maybe I would call it a gap, is that we do not have a lot of information yet among our healthcare providers. You find sometimes a child who's been coming to hospital many times and we've not yet identified that. So I would say we have a gap of awareness about autism and also how we can link these children to care. So I'm actually happy for such a forum, because we help even our fellow health workers to realize that this is the kind of therapy these children require. This is the kind of interventions that these kids need. So I would say maybe there's a gap in terms of awareness and how to link these children to the right support care. Yeah.
Dennis, you've given very detailed information about stimulus and also interventions, but do you get frustrated when people either ignore them, or do you also have to provide additional support for the parents?
Initially, you get frustrated, but you get to realize everybody is on a journey. Everybody's on a journey. Regardless of the fact, if you're a mom living with a kid living with disability, because the thing with disability is it's just a stone throw away from you. Your sister can get a kid living with disability. Your own daughter, when she gets married, she might, you see? Your nieces, everybody in your vicinity can be in this kind of predicament. So my issue is usually with the social model of disorder, in which we kind of impose ourselves on people living with disability instead of us knowing how to live with people living with disabilities. And that's like the main issue we have. In terms of that, then it trickles down to information to the masses, especially in an African context, because we are slightly behind the Western counterparts in terms of information regarding autism in particular. There are numbers of practitioners here in the African continent, the number of schools to cater for this kind of kids, so that they are in an inclusive community where they're allowed to access the best quality of life available to them.
Okay.
Yeah. So for me, everybody's on a journey. I feel like even there's someone who is listening to this podcast who might not have heard about autism, or maybe now has better insight to what autism is.
Yes.
Yeah.
All right. In line with that better insight, when we come back, we'll actually try and bust some of the myths that have been going round right here on the Med Squad podcast. Welcome back to the Med Squad podcast, where it's time to unlearn some of the myths that we have heard, especially in Africa. So what I'm going to say is just make some statements that have been thrown out in society, and you say whether they're true, false, or it's complicated, but then you explain briefly why. So number one, autism is either a curse or a spiritual attack.
False.
False. Please explain.
No need to explain.
No need to explain. Okay, in fact, that one will leave them. So the other myth is only boys get autism.
That's false.
That's false. All right. All children with autism are violent or display violent tendencies.
False.
False. All right. Vaccines cause autism.
False.
False.
And I'm happy you've asked that, because we've had some controversies. Some studies had been done that were associating the measles. We call it the MMR vaccine that we give at 9 months and 18 months. So there were some studies that had linked actually the measles, mumps, rubella vaccine to autism. But recently they have actually been retracted. That information is incorrect.
Okay.
So actually, that was one of the things that actually some parents were shying to take their children for immunization because of that attribute of being linked with autism, but that has actually been retracted.
Okay.
And that is not correct information.
All right.
Yeah.
As a
However, if-
parent, I have
Okay.
a different
Mhm.
opinion.
All right.
We could agree to disagree.
Mhm.
Our kids, most kids that like in the support group, I told you we have a support group, and we did a poll, and you could hear that the parents are saying from this and this age, there was a bit of speech, but when it got to this stage, it just disappeared. And it is around that age, 18 months too. And that is when they get the final dose of the MMR. And that research has been going on, but we feel as parents and caregivers that there's something that vaccine, either if there's a genetic issue because it's not all kids. See, like I have 4 children and it's only one who has autism. So is it that a genetic inclination to that? You know, there's just something that happens at that age. Why that age? Is it the point where the development is taking place? You know, there's certain milestones that are achieved, like speech and social interaction. So we still have, as caregivers, we still don't agree with the medics on that.
Wow.
To answer,
Yeah.
I think the basis of science is to measure such a probability. If it happens, then to make a hypothesis that might become a theory at some point.
Yes.
I wouldn't say you're wrong, because that's something that needs to be picked up maybe by a body such as Cambry. But the thing about autism, it's genetic. So it's not acquired. You can't acquire it postnatal. By genetic, I mean there is an element of the genetic code that's kind of altered when the baby is being made in the womb. So if it was possible for someone to acquire autism post 2 years of age, it means anybody can acquire it at any one point, because it means if this particular vaccine is injected in you, it might alter your DNA to some point for you to present with autistic
Like your gene is
characteristics.
disposed to that.
Yeah. However, I think it's a conversation that's being held. Then maybe they might, with more research being done, we might get better insights of what's happening. Yeah.
Okay. The conversation will continue on that one. So there's another myth that is thrown out there, that therapy will make my child quote unquote normal by whoever's standards.
The child is not abnormal.
Yes.
But I have to agree that therapy improves the functionability.
Communication,
Yes.
yeah.
Okay.
Communication,
Interactions.
ability to express the emotions,
Mm.
which ties in on the irritability and the ability maybe to commit a violent act.
Mhm.
Because if you do therapy, you're enabling the kid to be able to express themselves way much better.
Yeah.
Mhm.
So they might not get to a point where the anger is at a level where they feel like the only way they can express themselves is by
violence.
using violence.
Okay. Which kind of brings me to one other, I don't know if it's a myth, and maybe it's because people are watching series like The Good Doctor, that children with autism are geniuses.
They are.
Some are.
Some are
They have
geniuses.
exceptional skills, as
Yeah.
Pauline highlighted. Can be very good with math, solving problems. So yeah, some have exceptional skills.
So you can say
About 30% of them present with something called savant syndrome.
yes.
And they have something, I feel like it's more of a superpower. It's called hyperfocus.
Yes.
Like when they focus on something,
you can't.
yeah. So if you give them maybe something, say, if you teach them something like coding, they might get so good at it to a point where you might consider this person a genius in this particular kind of field. Take someone like Mozart.
Yes.
The guy just focused on music. Mozart, Beethoven. You get my point? They just focused on music. Einstein focused on physics and relativity. Yeah.
Okay. So
but they only focus it on one direction. It's never in several directions. Yeah.
You've already answered like two of these. So let me skip those and get to where someone is saying autism is new. It didn't exist before. Like how far back does knowledge of the existence of autism go?
Autism was there. Just that there's more awareness, and we're talking about less stigma, and people are talking about it more because also the diagnosis is easier now. So it has been there.
Okay.
Yes.
And then this one is not, this one even, how you should hide your child to protect them.
No. No.
Absolutely
Yeah,
not.
no.
So is there any parting shot you'd like to give as we wrap up this episode?
Yeah,
Aside from that,
we
yes.
need to know the son's birthday so that we turn up.
No, yeah.
Okay. So Daniel is turning 11 on the 9th of July.
9th of July.
Yes.
Wow.
Yeah.
9th of July.
We will revisit.
Yeah, for birthday.
So that's your parting shot for birthday wishes. Sawa.
Okay.
For me, I'm just inspired by Pauline, and you're an inspiration, Pauline, and I believe we can do more, especially in our country.
Yes.
Whereby this is something that people don't talk a lot about. So you can encourage more people, go outside Nairobi, so that we can encourage more caregivers, more parents, and also use that for advocacy to create awareness and help these children, create schools, environment, safe spaces for these children to thrive.
Thank you for that. For me, I would just like to say that early intervention is the key. I'd like to maybe talk to the parents out there and tell them that they are not autistic. They don't have a disability. That the best thing is immediately you notice there's an issue, because parents notice it. Even from the time of breastfeeding and weaning, you notice these challenges. So don't ignore it. Do something about it. Early intervention is the key to supporting your child to get an independent life.
Okay. Thank you.
Thank you.
Thank you so much, Pauline. Thank you, Christine. Thank you, Dennis. If there's anything you found useful in this, please share this information. And you mentioned that you talk to parents, even on social media. How can they find you, whether it's groups or whether they can follow you? Or
Yes. So we have a support group. It's called Autism Moms Kenya. And maybe you can just send us a message on Facebook, Instagram, on Mali Autism Awareness Center. Mali is my son's second name. So send us a message there, then we'll add you in the support group where we have professionals doing pro bono work. We have dads, moms, with children living with disability, all kinds of disabilities. And that's where we share our stories and just help each other. Thank you.
Wow.
Wow.
For me, all that's left to say is, Daniel Mali, you are an amazing young man.
Wow.
Fantastic young man.
Yes,
This
he is.
is the Med Squad podcast. Follow us on @the Med Squad Pod. We'll see you next time.